I'd say we're extremely progressive. How I look at it is I want to keep my family, my friends, my neighbors here. I want to keep them home. So I'm an RN by trade. I've been at Jefferson Community Health Life for 23 years. So started my career at Bryan, got into patient safety, risk management, quality, kind of progressed through as Chief Quality Officer, then Chief Nursing Officer, and now Chief Operating Officer. Any department that touches patients, they fall under me. So I know what patients want when they come into the hospital, and I feel like I try to work with my departments to make that patient experience what we know it should be. To me, a hospital is vital for a community. So I loved Lincoln, but I love being here, and I think primarily it's the people.
Anytime that you make somebody's day a little bit better, it makes you feel good that you accomplished something and were able to help someone else. I am the surgery manager. I'm also the specialty clinic manager over oncology. I grew up in Marion, Kansas, small town. Everybody knew you, cared about you, seemed interested in your life. When I was 11, my mom was diagnosed with cancer. And as a kid, I saw her being taken care of, and it really inspired me to want to go into healthcare. And the first surgical that I saw was an open heart surgery, and I was just intrigued and found it very fascinating.
I think how we've evolved is I think we do a really good job of trying to figure out what the community needs from us.
Personalized care in a small town looks like people knowing who you are. We want our patients to trust their healthcare workers and feel comfortable.
Not only want those services here to keep them close to home, but that patient experience is huge.
Orthopedics, we do robotic total knees. We partnered with Heartland Bank to purchase the new T-Mini robot. They can do a CT scan ahead of time to determine what type of knee and the sizes that they'll need. We do reverse total shoulders, we do total shoulders. We recently started offering total hips, cubital tunnel releases, carpal tunnel releases, and trigger finger releases for orthopedics. Robotic or laparoscopic removal of the gallbladder and appendix. Robotic hernia repairs with that new Da Vinci robot, so that's pretty popular. And then he does breast surgeries. And we just got a new urologist. And then podiatry, he does a variety of surgeries, OB/GYN. And then GI specialty comes from Lincoln, which they do colonoscopies and upper endoscopies, including EGDs. We also have Dr. Samuel Thompson that comes, and he's an ophthalmologist that does cataracts. So quite a variety of surgeries for a small town facility.
We have services that are extensive. Our focus on a daily basis is providing excellent care. I tell people this, if there's something that we are not doing for you, tell us. Reach out, call me. I want to know, because that is part of my job, is getting services here. We did get announced as a top 20 facility. There's so many things out there that we watch that ultimately kind of put us in that top 20, but we're also looking at services that we provide. Are we keeping people here rather than them out migrating?
Advances in technology have just been amazing. What else are they going to find to make surgery even better? That equipment locally close to home has been huge.
We progress through our jobs and where this hospital is going. I hope that Fairbury and Jefferson community can support us as much as we have out in the community over the last many years.
I feel like the community supports businesses and it supports healthcare. If they didn't, we wouldn't still have a hospital in a small town like this.